I give many talks in so many different conferences, webinars, and other forum. But today's topic is something which is very close to my heart, and therefore I'm quite emotional about this particular topic. Let me give you a quick background as to why I started doing research on this. As you know, the year 2021 marks the centenary of insulin's discovery. Insulin was discovered in 1921, and I'll talk about that in this lecture. But very little is known about what happened in India, either with respect to diabetes or with respect to insulin in the pre-independent era. Somewhere after 1950s and 60s, we do have publications which we can access. But before that, in the pre-independent era and in the time of the discovery of insulin, and even before that, what exactly was happening in India? How common was diabetes? What kind of treatments were done? Very little is known about this. So I started undertaking a long journey to try to discover some of these facts. And I must place on record the help that I received from quite a few people. One was my former student, Dr. Bavadarani, who now works at the University of Toronto. And she had good access to the library because Toronto was where insulin was discovered. So anything about insulin anywhere and diabetes anywhere is available at the University of Toronto. So she actually dug out a lot of pearls of wisdom and many original articles, which I'm going to present here today. But I also got help from Dr. Satyanath Mukhopadhyay, who is a colleague and a diabetologist, a professor at Kolkata. And he was able to take out a lot of information, particularly regarding Dr. J.P. Bose and his contribution, including getting a photograph of Dr. J.P. Bose, which is so difficult to find. I also got some useful information from Dr. Nalaperumal, my colleague and diabetologist from India. The Calcutta School of Tropical Medicine also helped me in this. And there are now, as an extension of this, I'm also working on the later part, what happened later in India, but that will be another story. So today's topic will cover the history of diabetes in India as we know it, almost up to independence, but then beyond that, a little bit about the developments of insulin in India, because I have been also associated with the latter part of it. So I thought I'll talk about that also. And that forms the basis of my talk. So are you all ready to start this journey? Let's go. The first report on diabetes in India, we don't know exactly when this was, but in the 2nd century AD and in the 5th century AD, two very famous doctors of ancient India, Charaka and Shushruta. Shushruta was a surgeon and Charaka was a physician. They have mentioned diabetes, and it was then called Madhumeha. Madhu is honey. And so the honey, the sweet disease, in other words. But they also knew of another type of diabetes, which today we call as diabetes insipidus, where the sugar levels are not high, and they called it as Ishumeha and Shitameha. So Madhumeha was diabetes, and the non-diabetic or diabetes insipidus was also described. What is fascinating is that Charaka and Shushruta were able to classify diabetes as Krisha and Stula, that is the lean diabetic and the obese diabetic. That will roughly correspond to the insulin requiring or the type 1 diabetes today and the type 2 diabetes, which is associated with obesity. They also knew that diabetes runs in families. They talked about the symptoms of diabetes, and they also talked, believe it or not, about the treatment of diabetes. And we're talking about 1500 to 1800 years ago in India, all this was described. And they talked about the value of diet and physical activity and why more vegetables should be taken and starch should be cut down. All these things were known to the ancient physicians. But what happened is that between that time, after the treatise by Charaka was written around 500 AD or so, until the year 1860, we are not able to find any mention about diabetes or any publications. There seems to be a long gap, and perhaps there could be something written which we still not able to discover. But when I started researching on this, I found that somewhere from 1860 onwards, that means for about 160 years or so, there are a lot of things described about diabetes in India, which the world did not know about. So I thought it's my duty to bring back all this into the regular stream of diabetes literature. Otherwise, this will be completely lost. So, along with my colleagues, Bavadharini's name is mentioned, Satyanath and Dr. Nalla Peruman, and also Dr. Mangesh Tivaskar from Bombay, and Dr. Anjana and Ranjit from our center here. We wrote this article about which we are very, very proud and very, very happy. Is recently published in the August issue, the latest issue of the Journal of the Association of Physicians of India. And the title of the article is Diabetes in Pre-Independence India, Discovering a Forgotten Era. Now, it's very important that this gets documented. And the reason we chose to publish it in an Indian journal, that too the Journal of the Association of Physicians of India, is that then every physician in India who is a member of this association, the Association of Physicians of India, will know the history of diabetes, because it goes to thousands of physicians and it will be on their desk. And instead of publishing it in some remote journal somewhere else, we thought this is where it should get published. And I would encourage all of you who are interested in the history of diabetes in pre-independent India to read this article, because already the feedback which has come has been overwhelming. People are simply excited to see all the pearls of wisdom which we have managed to discover. So let me take you through the story of diabetes in India from 1860 to 1950. Of course, the article is only 4 or 5 pages, so it's impossible to describe everything in that article. So a summary of it is given in that article, but I'll try to show you some of the original articles itself. Now, the first one that I could find was published in the Indian Medical Gazette. In fact, most of the articles were published in the Indian Medical Gazette because I think that was the article for publishing medical literature. I think it was the only article, only journal. A little later came the journal of the Indian Journal of Medical Research, the IJMR, which is still there today, and that has also crossed 100 years. But the Indian Medical Gazette was where almost anybody, any doctor who wanted to publish anything scientific in India published there, including a lot of white people used to publish in this. So I discovered the first cases of diabetes in India published on August 1st, 1867. And this is by Dr. K.N. Acharji. So he talks about just 2 cases. He describes a Nobin Chandar Bose, and he describes how he got this, all about his diabetes. And the symptoms are the same as what we would get today. And then one more patient called Surut Chandar Dutt. And this is another. And note that both these patients are from Bengal. And you will find that almost most of the literature which I was able to find in this is from either from Bengal or from Madras. And when I say Madras, it is a Madras presidency, which included a lot of Andhra Pradesh today, Telangana, Andhra Pradesh, and also Kerala, Karnataka, all came under what is called as a Madras presidency. And not surprising, because the British were most active in the Madras presidency and in Kolkata, and later, of course, Delhi. But since the history dealt mainly with these 2 cities, a lot of the literature is from there. There could be one other reason. Both these places, Bengal and South India, especially Tamil Nadu and the other states in South India, both are rice-eating places. And there is continuous, reference to this in the old literature, saying that somehow this excess starch that is consumed, carbohydrate, and specifically rice, is linked to diabetes. In fact, this is also very sentimental to me because we have published both cross-sectional studies from our cures study and also from the pure study, which looked at 21 countries. That is a prospective study, and this is published in the year 2020, where we showed that in South Asia in general and India in particular, in the rice eating places, taking excess of polished white rice is linked to the incidence of diabetes in India. So we are able to prove that. So it took so many years to prove it, but already our ancient physicians have already talked about this, and as a theory, not proven, of course. Today we are able to prove that. So these are the first two cases which were described. Now, in 1871, there was another paper which talks about, it's not very clear who wrote this paper. This is probably an editorial. But here, what they are talking about is the familial nature of diabetes in India. They describe again a family in Calcutta where they describe the number 1, number 2, number 3, number 4, number 5, number 6, etc. is from one family. And you can see that the full name is not given. Babu B died at the age of 65. He had acute diabetes, lasted only 20 days. So it must have been type 1 diabetes of late onset. And then the eldest son died of diabetes. The third son had chronic diabetes. Fourth son died of acute diabetes. Acute diabetes again could be type 1. And then the fifth one, age 65, has diabetes. So that must be type 2. And then the eldest son died of chronic diabetes. Second son has diabetes. And then the eldest son of number 4. So they're talking about the first generation, second generation having diabetes. So this, I would say, is the first report of the familial nature of diabetes in India. And we and others have shown that this familial nature is more common in Indians compared to the Western population. In fact, I published this in 1985 when I was working in the UK. And subsequently, several publications from our group in Chennai have shown the familial nature of diabetes. But you can see that it's very humbling that in 1871, they've already talked about this. The next one is just out of interest, that in 1872, there was a paper by one Dr. Spencer from Burtpur. And he says that skim milk treatment is a treatment for diabetes. The mechanism is not explained, but he talks about skim milk treatment. And this has been used in other parts of the world as well. I don't know how skim milk reduces sugar, but it has been used. And they describe this particular case. This is just out of academic. And remember, these are the days before insulin and before any of the modern anti-diabetic tablets. The tablets actually came much after the insulin. So we have these kind of treatments. There is eucalyptus treatment and all kinds of other treatments have been tried. Now, this is a very interesting report. In 1868, a doctor called Freyer, he was a ophthalmic surgeon. So he says when patients come for cataract surgery, he's talking about 146 cases of cataract. And in that, he says, I'm able to see many people with diabetes. And the connection between cataract and diabetes, he is able to explain. And he says this seems to be more in Indians. And again, he makes this particular case. So you can see that the ophthalmic surgeons are also picking up diabetes. This is a very interesting letter. Again, I don't know who this MG is because we're not able to find out the full name. But this seems to be a way in which research was done those days, because there was no epidemiology. There is nobody formally going to homes and collecting data. So they used to write in the journal, in the Indian Medical Gazette, and write it as a correspondence or a letters to the editor and ask certain questions if they want to reach all the doctors, because they presume that all the doctors who are academically minded will be reading this journal. So he is asking certain questions from the subscribers who have had experience of diabetes among rice-eating natives. See, again, he's talking about rice-eating natives. Is it common? Do you find sugar in the urine? Suppose you exclude meat from the diet, what happens? And all kinds of things. What is the prognosis, length of life? So obviously, he's interested in all these questions. But and then he says, I have found diabetes rather common among the class of natives mentioned. So he's trying to see whether it's due to rice. So right then, the interest in rice was there. This is 1885. Then the first report from Bombay that I could find was in again 1885, where one case of diabetes treated with jamun. You know that jamun is used in Ayurveda for treatment of diabetes. So Jambul or Jamun, but it was an English lady, Elizabeth Ording, 54 years old, born in Pune and living in Bombay, was admitted, and then they gave her this Jamun. So that is the only thing that could thing, and it's a case report. But this is the first report I could find from Bombay, and this is 1885. Now coming to Chennai and Tamil Nadu, 1887, one P.S. Muthuswamy. So now we'll call it as Muthuswamy. This is called Muthuswamy. He is a retired native surgeon from Tanjore, and he talks about various seeds which are used, and he gives the Tamil names for it as well. And he says if these seeds are soaked in water and then mixed with a certain amount of honey and given twice a day, it helps in reducing the sugar. No proof for this is shown, but he is talking about treating with seeds. Today we know that some of these seeds do have antioxidant and other properties. So this is described by Muthuswamy. Then comes a very important article there are a lot of Boses I'm going to talk about, and this is Kailas C. Bose. So Kailas C. Bose, again from Calcutta, writes a very important point. He says, diabetes is extremely common among the residents of the town of Calcutta, and you would be surprised to know that in Simla Street alone, with a population of barely 1,000 people, no less than 30 people were affected with it. So that's a 3% prevalence. And you're talking about 1895, a 3% prevalence of diabetes is actually very, very high. And so this is the first epidemiological study which he has reported. Of course, he also talks about acute diabetes and chronic diabetes and so on. This is Dr. Mitra. So I want to talk about Dr. Mitra, because Mitra plays a very important role in the history of diabetes in India. Now, this is a study which Dr. Mitra himself did. So he wants to get information. This is in 1894. So Dr. A. Mitra writes in the Indian Medical Gazette, and he says, will you give a place for this paper? I'm trying to find some questions about diabetes, and will my professional colleagues help me? Can you fill up the age, sex, race, profession, age at which the diagnosis was made, family history? So this is a structured questionnaire, exactly like how we would do a survey. And he's sending out to the whole country and saying, if you have any of these questions, you can, something like 27 questions he's asking. The symptoms, what is the diet before, what have you taken, did you have stress or mental grief? So he's talking about depression producing diabetes. Do you take any intoxicating drugs? So he's trying to find out the connection between alcohol or other things. So he thought of everything, and then he sends out this correspondence. Now, it's of interest that 2 years later, he writes, 2 years ago, you were kind enough to publish in your columns a letter from me on the subject of diabetes. Since then, many have responded to my request. Can you see how effective it was? 1894, he writes a letter, and people are replying to him and giving him the answers to the questions. So this is a good example of a collaborative research study done in 1894 by a pioneer, Dr. Mitra, and he was able to get epidemiological information from so many parts of the country. And he says, in the last medical congress, I read a paper giving a précis of 200 cases of diabetes in India. 200. Excuse me. That's a large number of cases at that particular time. At present, clinical material in my hand relates to over 350 cases of diabetes in India. And he says, I'm busily engaged in analyzing and collating them. I need hardly say that a collection of authentic information is yet very little understood, will throw some light on its cause. And he says, may I ask through this medium paper, those who are able to send me the history of any cases that they may know of. So I'll again write to you and see where he was based. He was based in Kashmir. Okay. So Dr. Mitra was based in Kashmir, and this is what he has written. So obviously people have responded to his particular request. Now, a landmark event which occurred in the history of diabetes in India, and it is called Diabetes in the Tropics, is a meeting which was held at Exeter in the UK in 1907. The people who were ruling India at that time and the physicians here thought it was so important, that diabetes was so important to India, and they recognized this more than more than 100 years ago, 160 years ago. They've already recognized that this is so important. So here these are the people who took part in the conference. Havelock Charles, obviously a white man, and Dr. Sandwith, obviously a white man. But look at this: Dr. Kailash Chandra Bose, Dr. K.C. Bose, and remember this particular name because it is very important, and Dr. C.L. Bose, and Dr. Satyasaran Chakravarti, and Dr. Devendranath Roy. So these are all people from Calcutta, and they have participated in this conference. And the proceedings of this meeting was published in the British Medical Journal on October 19th, 1907. So it's a BMJ publication. And why this meeting is very important is because of this particular. So the Dr. Rai Kailash Chandra Bose Bahadur, he talked about diabetes and gave his connection to that. But then we had Dr. C.L. Bose. Now, C.L. Bose, his full name is Dr. Chunilal Bose, and he was a father of Dr. J.P. Bose, about whom I'm going to talk quite a lot today. Now, C.L. Bose was an excellent clinician, and he was a chemist, he was a doctor, and he was a patriot. And he had actually warned about food adulteration, and he's written a lot of things on that. We'll come back to that. But the most famous statement that he made in this particular conference, which became history, is when he wrote that he talked about what gout is to the nobility of England, diabetes is to the aristocracy of India. So he made this particular statement. I have seen this statement when I was very young and started my work on diabetes. In fact, we keep quoting this, but we really didn't have the original paper. So I was wondering, where did he say this, and how did it get into the BMJ and so on. Now we have got the original article. This was part of this particular conference which was held, and this particular statement became very famous. What Dr. Chunilal Bose did was then to talk to his son, Dr. J.P. Bose, and tell him that he should take up a career in not only take up a career in medicine, but also devote his life to diabetes, because he says this is a very important thing. So I think it was the credit must go, although many others have said it, the credit must go to Dr. Chunilal Bose and his son, Dr. J.P. Bose, for taking up diabetes as a cause and then making it a very intense study, about which I'll be showing you the results of that. Now, Dr. Mitra also talked about it in 1908, just after Dr. Chunilal Bose talked about it. Dr. Mitra also talked about it, and he says, before the coming Indian Medical Congress at Bombay, I find one subject which is of great interest is omitted, and that is diabetes in India. So he's saying, you're talking about all other diseases, but you have left out diabetes, which is very important. Could it not be included? As I'm sure you will agree with me, that a collection of opinion on it will be a great help to practitioners in India. So you can see how he's making a case for diabetes in India. Maybe they're talking about diarrhea or tuberculosis or cholera and other disease, Kala-Azar. All these diseases would have been there, but diabetes is omitted. And he says you cannot omit it. It's very important. And in 1908, he was chief medical officer in Kashmir, as I told you. Okay. Around that time, there was another person whose name must be mentioned, and that is Dr. B.D. Basu. And the name of Dr. B.D. Basu became very famous because he wrote this book on the dietetic treatment of diabetes. And as you can see, this went on for edition after edition. You can see the price of that also. It's 1 rupee. 1 rupee and 8 annas was the cost of this book. It was published by Panini office in Allahabad in 1913. But this book was so good, it was reviewed again and again in the BMJ, in the Indian Medical Gazette. Many people have reviewed this. And then this is the 13th edition of the book. So it went on and on and on. So 1926, they've reviewed it again. And this is the 13th edition, again from Allahabad and Panini office. And this time the price has gone to 2 rupees. So in 14 years time, from 1 rupee 8 anna's cost, it has gone to 2 rupees. Slight increase due to inflation in 12 years time. So you can imagine how little the inflation was at that particular time. And they talk very highly about this book, because he talks about, because there's only things available. But remember, by 1926, insulin has already come. In 1914, when he wrote the third edition, fourth edition, insulin was not there. There was no treatment at all for diabetes, no known treatment at that time. But this is a landmark, because the history of the treatment of of diabetes by diet is very well described by Dr. Basu, who, as you can see, is a major in the army and is retired from the Indian military service. Now comes another article from Madras. This is in 1919, and this is by Dr. Krishnamurthy Iyer, who was a sanitary commissioner in Travancore. Now, of course, Travancore belongs to Kerala state, but at that time it was part of the Madras presidency. I've read this article, and what he talks about is that it's different castes have different rates of diabetes. He talks about the Brahmins, and the non-Brahmins, because he was a Brahmin himself. So he talks about Brahmins and non-Brahmins. And he says that Brahmins have the chief meal in the day, while among the non-Brahmins, the chief meal is in the night. So he talks about how the non-Brahmins have more of diabetes because they're eating in the night. Okay. Today we know the effect of chronobiology, and that if you eat too late in the night, digestion does not occur. And he talks about even the time, okay? And he says how the Brahmins work, how the Brahmins rest, and so on and so forth. He also talks about rice, and even distinguishes between the Kannadigas, the Canaries, and the Tamils and the Malayalis. The difference between, because he has lived in Travancore, and obviously he is from Tamil Nadu, so he is even able to talk about within the southern states. He says that in Madras, where more rice was taken, and he says ghee and chilies are taken in Andhra. So he makes distinction between that. Excellent clinical descriptions, although there may not be too much of science in it, but that's the best they could do in 1919. Remember this again, before insulin. Now we come to the insulin period. What about the period between 1920 and 1923, when insulin was being discovered in Toronto? So prior to a slight digression here to tell you the importance of insulin, because this is the 100th year of insulin. So slight digression here. So I'm sure you all know that children with type 1 diabetes prior to 1921 invariably died within a few months. They usually died of diabetic coma, but they became terribly emaciated, worse than many cancer patients. In fact, I've read descriptions even of Leonard Thompson, who was the first to receive insulin. They say they looked like children or adults in a concentration camp. I've gone to concentration camp, and I have seen some of the pictures there, because just starvation. They're just starved to death, some of them. And that was exactly how these children were. The word concentration camp like look was there. And when I show you some pictures, you'll know how they look. Just look at this child, JL, okay? Before insulin, age 3, his weight was 15 pounds. 15 pounds is like 6 kilos on December 13th, 1922. And this is another Teddy Ryder, who was a famous in this insulin story. He was one of the first to get it. Again, he weighed only 27 pounds. And look at this young girl. Look at her, completely emaciated, only skin and bone. And of course, different cures and, different, in the papers, they would advertise different quack treatments. And that's the only thing which they knew. But it was uniformly fatal and very, very tragic, because there's no hope for that child. So they simply had to allow the child to die. And here is to show the irony of the situation. This is a child with type 1 diabetes being taken to the mortuary. After it's died, it's being taken to the mortuary. So these were very common scenes at that time. Then came the the epoch-making discovery. I won't go into the details of this. It's a complete story by itself. But then Frederick Banting, the young doctor and orthopedic surgeon, who, with the help of Charles Best, a medical student who was in second year, did these famous experiments in the University of Toronto on dogs, where they extracted insulin. And then, of course, their boss, the controversial MacLeod, with whom Banting had several fights and arguments. And then, so he was a boss, and it was in his lab that these two people worked. And then later on, a chemist was brought in because the extract that these two people prepared, Banting and Best, was very crude. So a top-notch chemist called Collip was brought in, and he purified it. And then the first recipient was, of course, Leonard Thompson, and then Ted Ryder, and many others. And children who were dying suddenly sprang to life. It is a miracle of a sort which had never been seen in modern medicine. Nothing was more dramatic than giving insulin to a dying child who comes back to life. It's like a new life, new lease of life. The official announcement was made on May 3rd, 1922, after the first experiments were done. And you can see how the children were transformed. Here is this child, a young boy, on December 15th, 1922. And exactly 2 months later, just 60 days later, you can see how this child is transformed into a chubby child. And all that was done was insulin was given. So I tell all my children with type 1 diabetes that they should have a picture of Banting and Best and the four, because I'm not going to go into that. The Nobel Prize was actually given to MacLeod and to Banting and not to Best. And there was a lot of controversy, lot of fights regarding that, but that's another story. I'm not going to go into it. But anyway, insulin was discovered, and this is a dramatic change. Look at this girl here, how she was. Look at the flesh. There's no flesh at all there, only skin and bone. And then she becomes like a normal girl, and then she grows up into a young adult. Many children with type 1 diabetes who otherwise would have died started living for 10, 20, 30, 40. Now we have, even in India, people who have lived for more than 70 years with type 1 diabetes. And for that, of course, the Nobel Prize was given to Banting, and that's a telegram showing how the Nobel Prize telegram, those days, even today, I think the Nobel Prize is announced via a telegram, and that's Alfred Nobel's picture, which is there on the Nobel Prize medal. And I'm not going to go into the Nobel Prize controversy. And then, of course, these were scientists, Banting, Best, MacLeod, and Collip. They were all scientists. They were not. They could not scale up the production, and they were running out of dogs, and they were running out of. They tried from fish, and they tried from different sources. And then at some point, Eli Lilly and Company came into the picture, and they were given the license to produce insulin. And the world's first commercial insulin was called as Iletin, and it was produced by Eli Lilly in 1923. So 22, all the experiments over. 23, the insulin was produced, and that same year, the Nobel Prize was also given. So then the question came, and of course, commercial production started. So first countries to get it were Canada and US. Very quickly came to Denmark, because they also started producing it. Novo Nordisk started producing it the same year. In 23 itself, they produced it. And then, so they had Novo and Nordisk. So that is another story. We won't go into that. And then, of course, UK got it, and Germany got it, and Poland and other places started producing the insulin. So when did insulin come to India? We didn't know the answer to this until we started this research on the history of diabetes. And I thought it might have taken a few years for insulin to come to India, because they have to finish all the Western world before they have enough for the rest of the world. But I was very surprised to find that in March 1923, in the Indian Medical Gazette, insulin and diabetes in India is already described. And they're talking about the first one or two people who are, of course, this is a discussion as to how the insulin will take place. But they talk about the first person who probably would have received insulin. And you can see that already in the editorial, which has come out in August 1923, the editors have written, insulin has yielded striking results in the diabetes of children and young adults. And then they also talk about an overdose causing diminution of blood glucose below the normal limits, and even serious and fatal results follow, serious hypoglycemia. because they didn't know much about hypoglycemia and how to control it. Remember 1923, blood testing, there was no glucometers. So only urine sugar they would test. And you had to go to a lab to get blood tests done. And that also wasn't easy, as I'll show you. JP Bose did a lot on that. So very little was known how to regulate it. And that's why hypoglycemia, and they were very crude preparations. And they also point out in this editorial, it's difficult and expensive to make. So the idea about the cost has already come there. And this is the first brand of insulin which came to India. It's called as the AB brand of insulin. Why AB? Because A stands for Allen and Hanbury, and B stands for the British drug houses. So in collaboration with them, jointly they produced it. Therefore, it's called as the AB brand of insulin. And this is the first one. You can see the date here, May 1924, and you can see the batch also there. So there is clear proof that this has come, and this is taken from an Indian journal. So it has obviously already come there and it's already been used. There is also some discussion about the cost of insulin. And what this company is saying is that the price of insulin was further reduced in July 1st in 1924 by Burroughs Wellcome, which now the Wellcome Trust, is named after them, and by the British drug houses acting in association Allen and Hanbury. So they're talking about the AB insulin, and they're talking about 2 shillings as a price for 100 units of insulin. Those days, it was still quite expensive. So the cost of insulin was a factor. But they say the price of insulin today is about 1/3 of the present price in America. Even today in US, insulin is very, very expensive compared to what we get in India and in many countries. And it's very interesting that that time itself they are pointing out that it's only 1/3 the price. They're able to bring it. So 2/3 of the price, which is extra in America, is probably due to other reasons, commercial reasons. And they say British insulin is at least as good in respect of potency, consistency, and sterility as the American. So obviously, being British, they are talking about it, and that has direct impact for us, because this is the insulin which came to India. Then started discussions, a lot of discussion, because the first tropical country to which insulin is being brought, we were the largest colony, obviously, for the British. And therefore, a lot of discussion. Will it last? It's a protein. It's a hormone. It's a protein. So will it last in a tropical country? There was lots and lots of discussion. Here is one paper written by Dr. Taylor, who says the deterioration of insulin in India. And this is from actually from Burma. Okay. And they were all kind of a part of the same geographical region, as you know. And then this is by Dr. Stott. He is also a major, and he is a professor of pathology in the Lucknow University and King George's Hospital, Lucknow, which is still there today. And he talks about an experiment of 6 months duration and one batch of British insulin 8 months to show the extent of its deterioration. What actually happened was some people started saying, no, insulin doesn't work in India. It'll never work in India. What the company and some of the doctors did was they brought the insulin to India, sent some vials back to England, and asked them to send it back again to India. So much time has passed and so much changes in weather. And you can imagine refrigeration and all that may not have been that good. And they showed that still there was potency. So they said in India also insulin will work. Until then, there were doctors who said insulin will not work in India at all because it's a hot climate. Then a lot of discussion took place on this and so many papers on this. You can see a stability of AB insulin in the tropics, a note on the testing of insulin in India. And how they used to test the insulin, whether it's working or not, was they'll inject it into rabbits. And when the rabbits start getting hypoglycemia, they'll develop kind of fits. Then they know that the insulin is working. Very cruel and very crude method of saying it. But in 1924, that was how they were trying to find out. And, people like JP Bose went ahead even in that. They started saying that the type of rabbit also matters for the response. And that is differences in bioavailability or pharmacogenomics, which they're already talking about. He said pink rabbits work in one way, white rabbits work in another way, insulin varies. So he's talked about all that. JP Bose has talked about all that. So this is the first person with type 1 diabetes treated with diabetes in India. And this is in November 1923. So you can see the same year when the insulin was discovered, Dr. Proctor, who is also a major in the army, this is again from Calcutta, Presidency General Hospital in Calcutta. He talks about, but there's no name of this person. Case number 503, female, age 35 years, was admitted to Presidency Hospital suffering from diabetic coma. And he talks about what happened after giving her insulin. So the first documented type 1 diabetic patient in India was this lady. But I don't know whether she's an Indian or she was a white lady. And the report is from a white person, and no name is given. So really we don't. And also it's 35 years old. So one could argue it's probably type 2 diabetes and not type 1 diabetes, because it's not a child anyway. Then this is a very important turning point in diabetes history in India. I talked about Dr. Mitra, who played a very important role. He did those epidemiological studies. He made the plea for diabetes to be included in the Indian Medical Congress that was held, and so on. Unfortunately, Dr. Mitra died soon after that. And so here is his life history and all that written. And then the important turning point was his wife, his widow. So his devoted widow, Mrs. M. Mitra, happily still lives. She is also imbued with the spirit of love for humanity. And in memory of her revered husband, she has founded a research scholarship in diabetes, the disease from which Dr. Mitra died. So Dr. Mitra died of diabetes. And because of that, his wife said that, and he talked about probably his passion for diabetes came because he himself had diabetes. And you can imagine 1927, insulin had already come, and yet he died due to diabetes. He might have developed some complications and he could have died. So Mrs. Mitra starts a research scholarship in diabetes, and starts, this scholarship is tenable by an Indian. It has to be an Indian, at the Calcutta School of Tropical Medicine. And the present holder, Dr. J.P. Bose, has made a number of valuable contributions to our knowledge of diabetes as it affects the people of India. So Dr. J.P. Bose was lucky. His father had already told him about diabetes. Dr. Mitra, obviously he knew because he is his father's contemporary. And then the scholarship is created to do research on diabetes by Mrs. Mitra, and he is chosen as the first recipient of this scholarship. So they talk about life of Mitra should be prominently kept before the young men of Bengal as an example of what can be done, and their guiding star. So that's the Calcutta School of Tropical Medicine shown there, where the first department of diabetes research was started. Obviously, there was a clinical unit also, but they didn't call it a diabetic clinic. They called it as a diabetes research department. They also called it as a biochemistry and diabetes research, because I think it was closely linked to the biochemistry department as well. But this is the turning point where a department has been set up. And remember, this is 1927 in the British days. So let's talk about Dr. Jyoti Prakash Bose, or J.P. Bose. Dr. J.P. Bose was born in 1894. So in 1907, when his father Chunilal Bose went to England, he must have been 13 years old. And it was at the age of 13 that his father must have told him, look, I've come back from England and you must take up medicine. So he could not have obviously joined for medicine. It struck a great chord in me because it was when I was 13 years old that my father talked to me first about diabetes, and he kind of convinced me that I should do medicine and I should do diabetes. And here is a father-son combination, more than 100 years before that. But that's a time when my father was not even born. And at that time, there's already a father-son combination doing diabetes, and history has now repeated itself. And I was very, very struck by this coincidence. So Dr. Bose did his MBBS from Calcutta, and he was in charge of the Diabetes Research Center, the School of Tropical Medicine. And he has made many, many contributions, as I'll show you, to diabetes and to medicine. And he worked even on pregnancy. So he's worked on GDM and diabetes complicating pregnancy. He also showed that the pituitary gland, anti-pituitary gland, plays an important role. In 1922, he has already shown that. And then he has worked on the potency of insulin and keeping the quality of the insulin. And then he has authored a book called the Handbook of Diabetes and Modern Treatment. I'll show you that. And he was made a fellow of the Chemical Society London. He was a recipient of the Minto Gold Medal in 1935. He was also made a fellow of the Indian National Science Academy, INSA. And I'm very, very proud many, many years later when I was also elected a member of the INSA. It's called FNA. It's a unique honor, and very few Indians get elected to the FNA. And there is in the annals of the Indian National Science Academy, his small obituary is mentioned. Although many of the data was missing and there was no photograph. And this photograph, I must thank Dr. Satyanath Mukhopadhyay, who talked to the relatives of Dr. Bose. His grandson's wife actually was able to give this photograph. It's a very precious photograph, and I'm so glad that we could get it and publish it in JAPI and in in the Times of India and a couple of other places, because Jyoti Prakash Bose or J.P. Bose deserves his place in diabetes history of India, and so does his father, Dr. Chunlal Bose, and so does Dr. A. Mitra. Now, this is a very important paper from Dr. J.P. Bose. I'm going to show you some of his contributions, published in April 1930. And he has already got a large series of children treated with diabetes. He has analyzed a lot of the cases. And he says, before him itself, he talks about this. In India, the late Rai Bahadur, Dr. U.N. Singh, reported a case of diabetes aged 6 years. But we don't know the age of the patient and we don't know in which year. So before Kumudini, who I'm going to talk about, there was already a child who was 6 years old. Then he says the youngest case in my series was an acute case of diabetes in an Anglo-Indian boy of 8 years. So this again in an Anglo-Indian boy. But again, the name of this child is not given. And then he says that there is no doubt that diabetes is much less common in children than in adults. We know that type 1 diabetes is less common. And then he says, this is my excuse for publishing the short note on the following case of diabetes in a girl 12 years old. And he says only the salient features of the case are given. And this is the famous Kumudini, whom he talks about. So Kumudini is a Bengali Hindu female. She was aged 12 years. And she was admitted to the Carmichael Hospital for Tropical Diseases on 23rd of June 1929. You can see the same emaciated look which I showed in the earlier pictures from Toronto in Canada. You can see how emaciated she was. And after treatment, you can see she has completely changed. And this is the miracle of insulin. Dr. J.P. Bose includes other children. You can see this boy, how emaciated he was, and how he has become a normal boy. And here was a girl who was in a wheelchair because she was about to die. I mean, so sick, and she couldn't even walk, emaciated. Now she's become a normal child, 13 weeks after insulin treatment. So within days, weeks, and months, there is dramatic improvement. And this demonstration from India has come only from Dr. J.P. Bose. And therefore, the full credit for describing the miracle of insulin must go to Dr. J.P. Bose. He also talks about the potency of insulin in the tropics, like the other people had done. And he says, I've tested it in different rabbits, as I told you. And he says 2 or 3 rabbits were used. And he talks about natural variation in the rabbits and so much of experimental work. Also being a clinician, he has done. And you can see here that Dr. Mitra, research scholar in diabetes, Calcutta School of Tropical Medicine. He also talks about, then this is a very important thing. One Dr. Lal Mohan Gosal or LM Gosal, he says insulin treatment has become a very common practice, but he says that insulin is being extolled to the highest degree in Europe and US, but he says it is not beneficial. It is too early. It is not a magic cure. And why should it be used at all in India? He says there is no place for using insulin in India. So he makes a very strong statement saying that insulin is not needed in India, and there is absolutely no place for insulin treatment because our diabetes is different. That's what he keeps talking about. And he says he was a demonstrator of physiology in the Medical College, Calcutta. I don't know how good he was clinically, but anyway, he makes a statement that there is no place for insulin treatment in India. And guess who responds to that? Dr. J.P. Bose. He gives a fantastic rebuttal to Dr. Gosal, and I'd like to read it. He says, in the June issue of your Gazette, Dr. Lal Mohan Gosal published a paper in which he has made some sweeping and unwarranted statements about insulin treatment in this country. He begins with the statement that insulin treatment as diabetes has become a common practice. But as far as my experience goes, not much benefit is accrued from it. Then he says, as my experience in this goes, about 400 cases of diabetes, various grades have thing, are completely contrary to his conclusions. I write these few lines to show the basis of Dr. Ghosal's conclusion is fundamentally defective, and therefore they are unjustifiable and unacceptable. He completely demolishes Dr. Ghosal and shows 400 cases where he has treated. So he says, as far as my experience goes, insulin is not only palliative, but in suitable cases is curative agent as well. It may be stated that I have under my care a good number of cases of diabetes, some of which have yielded completely, and the rest are decidedly benefited by it. And he also describes who are the people who should get insulin. He says there are people who have pancreatic deficiencies, talking about C-peptide values being low and insulin deficiency being low. And he says there are direct means by which the islet cells could be determined. And he talks a lot about it. And he says where there is insulin deficiency, you have to use insulin. There's a fantastic rebuttal. I really enjoyed reading this debate between Ghosal and J.P. Bose. And J.P. Bose obviously demolished Dr. Ghosal's objections, which were ill-founded, of course, based on very small 1 or 2 cases which didn't respond. They must have had insulin resistance. He probably didn't use the same correct dose. Then he talks about, Dr. Bose then talks about a study of the distribution of sugar in the blood of diabetic and non-diabetic subjects. He tests sugar in diabetic people and non-diabetic people. And what is fascinating is, look at this. He goes on case number 1, case number 2, case number 3. He measures the glucose, and he did it himself. He worked in the lab. He himself measured the glucose. And he's saying, and he's done GTT using 50-gram glucose at fasting 1 hour, 2 hour, 3 hour, like we would do today. And he talks about the reading in the whole blood, plasma, corpuscular sugar, and plasma to corpuscular sugar ratio. All this he kind of talks about. And what happens in the fasting, what happens at 1 hour, 2 hour, all this he talks about. So beautifully, this is like a classic paper describing the relationship between plasma glucose and whole blood glucose. And if you look at what all he has written, today I've read through all his papers. Today, if we were to rewrite, if we were to write, everything is correct. His observations that he has made, 1932, what he has written is absolutely spot on. He talks about insulin resistance. Already using in 1950, he has already described insulin resistance. So he says cases of diabetes requiring extraordinarily large dose of insulin. That's because of antibody production. We know that most of this insulin came from bovine sources, and bovine and human, I'll talk about that. So he already talks about insulin resistance at that time. These are the books, the handbooks he has written. He has written what can be called as a Bible or the Gita or the Quran of diabetes treatment. And this is, his first edition he published in 1928, second edition, third edition, fourth edition, fifth edition. I'm very happy that thanks to Dr. Satyanath Mukhopadhyay, he has given me all these editions. So I have the original editions of each of these, and you can see it's published from Calcutta. You can even see the price there written. 15 rupees is the cost of that, and that I think was published in 1962. So these are all historical. If you read this book, he describes children with diabetes, adults with diabetes. Again, Kumudini and all those boys' pictures which I showed you, they are all there in that. Fascinating. And if you look at the title, A Handbook of Diabetes Mellitus and its Modern Treatment, because insulin has come. And by 1950s and 60s, tablets have also come. So he keeps updating it. And you can see from 1928 to 1964, almost for 40 years, he kept this book going, updating it. Remarkable for a physician and a diabetologist at that era to write it. And about this book, very good reviews have been written. So Dr. Bose's book has been reviewed, and so well it has been received. This is in the journal of the AMA. I'm not sure what the AMA is, whether it is JAMA, I'm not sure. But anyway, they talk about the price and where it is thing, and they really praise the book. Written in an orderly manner and with a delightful English style. The author is a native of India, educated in Calcutta and London, and for many years the physician in charge of the diabetic department. and he says what is different in this book. They also talk about Charaka Samhita and 2nd century AD, and Agnivesha and Atreya, from where Charaka got his infant. All these are kind of described here in this review. And another very interesting that I found was that J.P. Bose collected his father's, all his father's scientific, Chunilal Bose's. He collected scientific and other papers of Rai Chunilal Bose Bahadur. And J.P. Bose publishes that. So he has paid a rich tribute to his father. And he talks about what are all his, of course, his father didn't work only full-time in diabetes. He was a physician. J.P. Bose worked almost full-time in diabetes. So he talks about what all his father has done. It's a very great tribute that is paid to his father. Now, digressing a little bit from insulin, the talk about the rise and the connection to diabetes and why diabetes was so common, the type 2 diabetes was there for many years. You can see in 1925, Robert McCarrison has talked about we have diabetes is very common, and the sugar is due to consumption of rice as well as lack of exercise. Both of that we know are true. And then for those who are interested in the connection between tuberculosis and diabetes, we know that TB is common, diabetes is common. But here is a report published again from Andhra, Madanapalli, where they have talked, two people have talked about the relationship between diabetes and TB. And this was in October 1940. I want to talk about something which recently I came to know, and I'd like to thank Dr. Shashank Joshi for pointing this out to me. In the Journal of the Indian Medical Association, none other than Dr. B.C. Roy. You know that Dr. B.C. Roy was the physician to the father of the nation, Mahatma Gandhi. He was also Chief Minister of West Bengal, a very erudite scholar. And we all know that the July 1st is celebrated as Doctor's Day in India, because B.C. Roy was born on July 1st and he died on July 1st. Both and birth anniversary and death anniversary of B.C. Roy was on July 1st, and that's why July 1st is called as Doctor's Day. We also know about the famous B.C. Roy Awards, of which I was humbled to be one of the awardees as well. What I did not know was that Dr. B.C. Roy has worked on diabetes. This is another masterpiece of an article which Dr. Shashank Joshi pointed out to me, written in 1942, where he says the pancreas, yes, pancreas is very important, but pancreas is not the only cause of diabetes. There are other reasons. Today we know, due to the work of Ralph DeFronzo and others, the ominous octet, how many organs are involved. 8 different places we have pathology in diabetes. He talks about these. Can you believe it? He injects insulin. He gives glucose orally, and he gives glucose intravenous, and he measures the glucose in different patients, and he shows that there must be an intestinal factor, and he talks about so many things here. Very masterly written article, and my admiration for B.C. Roy went up so much that he knew so much about diabetes is something amazing. And look at the dates when it's done. 1934 is published in 42, but in 34 he has already written on that. And of course, Dr. Shashank Joshi and the editor of JIMA, Dr. Jyotirmoy Pal, have written a commentary on this. What all he has talked about. He's talked about secondary diabetes. He's talked about, in the brain connection to diabetes, and all kinds of other things. He talks about reversal of diabetes. He says that if you put people on a strict diet and cut the carbs, diabetes can reverse. And that is what Dr. Roy Taylor showed many years, 100 years later, in the direct trial. So all this has already been shown by him. Here is another paper which talks about insulin sensitivity among Indian diabetes. You can see that you're coming to 1947, the independence time. And so different, they talk about insulin sensitive diabetes and insulin insensitive diabetes. So that resistant diabetes. So this is what we would call as the SID. Today, you know that we have classified diabetes type 2 into different types. The severely insulin deficient variety, as well as the insulin resistant variety, and the combined insulin resistant variety, and the mild age related MART. That's an observation we just made this year. And they have already talked about it in 1947, saying insulin sensitive and insulin insensitive types. And then, of course, comes the Independence Day on 15th of August. As I record this, I'm recording it on the 14th of August 2021. So tomorrow is the Independence Day. So I could not resist showing our flag when we got independence. Immediately after independence, one name comes up. I'm very proud that it's my father. So Professor M. Vishwanathan, considered as the father of diabetology in India, he started the first diabetic clinic in India in the year 1948. Now it's very interesting that in 1923 insulin was discovered, and the first children to get insulin was 1923. That was the year when my father was born. In fact, he was born in August 1923, and it was in September, October 1923 that the Nobel Prize for Insulin was given. So I see this as one more connection. And of course, one more connection to J.P. Bose and Chunilal Bose, because my father who brought me into diabetes, just like Dr. Chunilal Bose brought J.P. Bose. Of course, in the Stanley Medical College Hospital, a very small clinic he started in 1948 with manual records. Something told him that, this could become a big disease. So he told his boss, Dr. K.C. Paul, who was the only physician going to General Hospital, Madras Medical College, Stanley Medical College. My father used to go with him as a junior doctor. So one day he told him, why not just settle down in Stanley and start a clinic here? And even he was not convinced, Dr. Paul, saying, why would you start a diabetic clinic? There are hardly any cases. And he said, no, sir, I feel that this is going to grow. So that's a visionary. And then later on, the clinic became a department. And 2 or 3 years ago, it's been upgraded into an institute of diabetology, which you're seeing here. The picture on top is the old Stanley Medical College. And this is a whole institute for diabetology, several floors, which I've had the opportunity to visit. So this is history made, and it's immediately after independence. So it's correct to say that in post-independent India, this is the first diabetic clinic. And of course, it's the first dedicated diabetic clinic. One can argue that the J.P. Bose clinic was combined with the biochemistry department, and it really wasn't a clinic as such, but more of a research unit. This was a clinic which was looking after diabetic patients. And another landmark in India's diabetes history is this conference, which was held in January 1966. It's held in Bombay, and it was organized by Dr. J.C. Patel and Dr. N.G. Talwalkar. This was, to my knowledge, the first meeting or the first Congress on diabetes. They called it World Congress on Diabetes and Tropics. Everybody attended that conference. I'm not sure whether J.P. Bose attended, because J.P. Bose died in 1968. So I'm not sure. But in this one remarkable thing which was done, this was my father's first conference, and it was his first exposure of his work done in Stanley, and he became famous overnight after going there and presenting in that meeting. And of course, Dr. S.S. Ajgaonkar and many others were there. But one thing which was very important in this particular book is that Dr. S.S. Ajgaonkar's son, Dr. V.S. Ajgaonkar, in this particular book, it's a 500-page book. In this book, he compiled all the literature published on diabetes from India by Indians up to the year 1966. So all of J.P. Bose's publications are there. Of course, my father's publications are there, because it's about 20 years after my father started. You can see even Dr. Ahuja's publications are there. So Dr. Ahuja also started, but it's all 1960 is the earliest from Dr. Ahuja. So his publication, you can see Dr. Ajgaonkar's publication. Anybody, he has arranged it in alphabetical order. So it's so easy to take out from this. And this is another treasure which I found during my research. Now, just moving on to the last part of my talk, what happened to the insulins in India after that original AB insulin was introduced? In 1960s and 70s, when I joined my father in 1971, 72, the insulin we had in India was called as the Boots insulin. Earlier it was not highly purified. It was just a crude preparation. We had plain insulin, lente insulin, the protamine zinc insulin, PZI, and the neutral protamine Hagedorn insulin. This came from Denmark, of course, by Novo Nordisk. But most of the insulins came from bovine sources. And as I'll show you, they differed from human insulin in 2 amino acids. Then came the porcine insulin from the pig, which was closer to the human insulin because there's only 1 amino acid difference. So these insulins were called, the old insulins were called as dirty insulins. because they contain a lot of impurities. Impurity was mostly pro-insulin, little glucagon. All these get mixed up when you make this crude extracts. This, of course, results in insulin allergy, insulin resistance, which has been described by the earlier papers which I showed you. It also leads to the wasting of the fat in the under the skin. It's called lipoatrophy, or sometimes the fat becomes more lipohypertrophy, and of course antibody formation, because it is not human insulin. So antibodies form. Because antibodies, they become insulin resistant, and they need huge doses of insulin. In fact, we were some of the earlier people to work on this in 1980. When I was still doing my MD, we published this paper on insulin antibodies in diabetic patients, and we showed how long it takes to develop the antibodies. I'm just showing you some of our own work in this field. So later, of course, purified insulins were introduced. Lilly introduced the single peak or the SP insulin, and Novo introduced the monocomponent insulin. And I was around when the MC insulins were introduced. They were fantastic compared to the crude insulins. They were still made from the pig, but they were highly purified. So the incidence of allergies started coming down. Allergy, lipoatrophy, all these disappeared. Now, this is what I was telling you, that the bovine insulin, this is human insulin structure. And bovine insulin actually differs from the human insulin in 3 amino acids, whereas porcine insulin differs in only 1. So 2 more differences are there as far as bovine is concerned. And therefore, bovine insulin is more antigenic than porcine insulin. But there are also problems after purified insulins came. For example, there's possibility of shortage of the insulin. People said there will not be enough pigs, there will not be enough cows, and therefore the world will end for type 1 diabetic patients. That is what they said. And then certain religious prescriptions, the Muslims were a little reluctant to take pork products. So they said, we will not take pork insulin. Hindus said, oh, beef pro insulin, we will not take beef. All that was there. Of course, they talked about allergy and lipoatrophy. Now, allergies, we reported, this is one of the papers, I was the first author in 1983, we reported allergy even to the monocomponent porcine insulin. And we even reported one case of human insulin allergy. When human insulin came in 1981-82, by 83, we had the first case of human insulin allergy. It's very rare, but we picked up one case. We also measured antibody levels after monocomponent insulin therapy, and we showed that the antibodies come down. Once you can see here, antibody 24,000 antibodies came to 48. This is using the old insulins. This is using the new insulins. So dramatic reduction in the antibody response. Then, of course, came this NIH report, which said that whatever pigs and cows you have, by 1992, the world will end, because the human requirement is going to go so high that whatever you produce insulin from the animals, you will not. This is made in 1975. And everybody was scared. But the necessity is the mother of invention. And by 1981, human insulin was first produced by Eli Lilly, and very soon afterwards by Novo Nordisk as well. And therefore ensured that there will be no more shortage of insulin. This is by recombinant DNA technology. This is what is shown here. So they have the E. coli bacteria is used, and one set of E. coli bacteria produces the A chain of insulin. As you know, insulin has 2 chains, A chain and the B chain. And then, this is the A chain, this is the B chain. So the A chain is produced by one set of bacteria, another set of bacteria produce B chain, and then you combine them using air oxidation, and this disulfide bridges are built there. So this is how human insulin looks like, and they are now able to produce it quite easily and in bulk. But the human insulin which is produced also does not mimic the basal or the physiological profile of insulin, because you're injecting it through the skin, whereas the insulin produced in the body is produced with the pancreas and directly goes into the blood. Here you have to, because if you take it orally, it will get destroyed, being a hormone. So therefore you have to inject it. So you have to give it about 30 to 45 minutes before food, and hypoglycemia can come after 4 to 6 hours. So then different companies started producing what is called as designer insulins. Further, tweaking of the insulin structure, which I just showed you. And so Lispro came from Eli Lilly, Aspart came in from Novo Nordisk, and premixed analogs from Novo Nordisk as well. And then long-acting insulins also came, where we have Glagine from Sanofi Aventis, and then we have Detamar or Levemir from Novo Nordisk, and then Degludec or Tresiba from Novo Nordisk. So all these insulins came. We also have co-formulations now, Rhizodec, where this Degludec and this Aspart are combined. So today we have so many choices. It's like having a designer insulin, so you can choose your patient, and they're more expensive, but at least for those who can afford. And the other thing is, you don't have to wait for 30 minutes. You can inject it 10-15 minutes before food. And that's how the analogs work. You can see that when you have in the normal human insulin, they exist in a hexamer form. Those 6 molecules joined together. They have to break down, and only when they become a monomer, single molecule, they can enter into the blood. Whereas these are because these exist in the new analogs, exist in monomeric form, so they can directly enter into the blood. And these are all the types of short-acting and long-acting insulins. Now we come to the last part, and that is about the insulin delivery devices. When I started my career, we had glass syringes like this. You can see the size of the syringe and the size of the needle also. It's thick needles, like we use for giving to animals and so on. So that's the kind of insulin that we had. And the other thing is, you have to boil it each time. And however much you boil, sometimes infections will come, so abscesses will come. Then came the disposable syringes, different types. First thick ones, then very thin ones. All that started coming. And then came the insulin pens, and there are different types of pens which can be which are introduced. And the pens make life much easier. You don't need the bottle, you don't need refrigeration, you can carry it with you wherever it thing. There's no stigma attached to this. And then came the insulin pumps. Now, a pump is a device, which is a battery operated device through which the insulin can be given, and you can control the rate of infusion. The original pumps like this in 1970s were huge, like a backpack. Then even the wearable ones were very big. And then slowly, you can see the size. Slowly, they started coming down. Now they are like a small pager, much smaller than a cell phone also. And many of them now have even blood glucose built in to that. And so we are slowly moving. You can see the size of the pump, how it has come down. And therefore, all these pokes with the 4 times a day, that can be avoided. In fact, 1983, we already reported our first experience with the insulin pump. When working in Germany, I worked on this machine in 1985-86 on what's called as a biostator. A biostator is a closed loop system. So you can attach a person to a glucometer into this artificial pancreas, and the biostator will find out the blood glucose level. It will determine how much insulin to be given. Everything can be done by the person, by the machine itself. And that became a very big thing at that time, but it's very cumbersome, very expensive, and too many technical problems. Today, the artificial pancreas is going to get smaller and smaller. You can see it's like a pump only, but there is a sensor attached to it. So the sensor tells the pump how much glucose to give. The glucose readings also come. So the entire, although you don't have a pancreas which works properly in a type 1 diabetic patient, all this can be done through using the artificial pancreas. Better and better models of them are coming. So to conclude about the insulins in India and the history, we have come a long way from the crude AB insulin of 1923-24. And today we have some of the best insulins in the world and the best tools to deliver them as well. So I will stop here by once again thanking the discoverers of insulin for discovering insulin, and once again paying a very rich tribute to Banting, Best, Bose, both the Boses, Tunilal Bose, as well as Dr. J.P. Bose, and of course to my father, Professor M. Vishwanathan, and many other colleagues in India who have helped to improve the lives of people with diabetes in India. Thank you, and Jai Hind.